I'm Ross Rounsevell. I am Research Partnerships Lead for Sano Genetics, and I work with research organizations helping them use our technology to better engage with research participants.
I'm George Bowley. I am an account executive with Sano Genetics, and I'm also helping research organizations with participant engagement programs. So, purposeful participant engagement. It's not just sending out some random emails and hoping for the best. Can you break it down for us? What exactly is purposeful participant engagement, and why is it so crucial for research studies?
Purposeful participant engagement is about making the way that you interact with research participants not an afterthought. It is taking what amounts to not a huge amount of time to actually plan how you intend to interact with them in the short, medium, and long term. And it's really to think about it in terms of the complexity of this method of communication, this process of communication, does not actually necessarily correlate with quality of interaction. I think another component of purposeful engagement is not only planning what you're going to share, but when you're going to share it. And this sort of strategy, this engagement strategy, doesn't have to require incredibly frequent communications. They just have to be regular, and they have to be considered. So you have to consider the audience that you're engaging with. And I think often researchers make or think about content that needs to be shared with people or research participants. They think it has to be incredibly sophisticated and complicated, and it really doesn't. Researchers are focused on research outputs, and so often confuse what's interesting to participants as being the final output of that research. But in reality, most research participants don't know how research happens, don't know the challenges that researchers face, and are often really quite satisfied with any understanding of the progress towards the ultimate research goal.
If I can jump in there, what happens if we get this wrong? What's the impact for the patients and for our work?
There's many ways to get it wrong, and often they're simple to remedy. I think often it is sharing information which is not relevant to those individuals. So maybe having something that is content that's geographically focused, that isn't relevant to another individual from a different area. I think getting it wrong is making it too complicated. Updating on the research in a way that actually you'd have to be a researcher to understand. People want to hear straightforward concepts, or like straightforward concepts that can capture their imagination. And often that can be as simple as indicating whether you've as a researcher, hit your recruitment target for your study, whether that you've collected any materials from people, whether they've been analyzed. I think ways to get it wrong, the fundamental way that you can get communication research participants wrong is not communicating with them. That is often the biggest mistake that researchers do, because they make it too big a challenge in their minds for what is effective communication with research participants.
There's a line, I suppose, isn't there, between the bare minimum, you have the discussion with the clinician, you read the ICF, you make sure you understand the program, and then it's going beyond that. But how do you really bring patients in beyond just informed consent and into actually engaging with it? What's some good strategies for that?
I think making sure that first touch point, that patient information sheet or the participant, that the information that orients that individual on the research study, I think it's really setting up that interaction early, so front loading it. I think in many ways it sets the tone, and I think it's really fast following with showing gratitude for their contribution beyond that initial consenting event and contribution of the initial data set, is giving that waypoint to say, thank you for joining this study. We appreciate how you've contributed at this point. We are excited about you joining the study. We will be in contact soon. We'll give you monthly updates. So again, it's coming back to this, what's purposeful engagement is saying, we will commit to monthly updates. Sometimes they will be longer, sometimes they will be shorter, but we will keep you updated on how we're making progress using your data. And we may ask other things of you. So we would really hope that you would continue to contribute.
And there's obviously different scales of studies that may or may not require levels of patient engagement. And for those smaller studies, for the less seasoned researchers, if you will, versus the big institutional programs, how do you sell them, I suppose, on the importance of patient engagement when perhaps it would be a big lift to deliver that, or I suppose sell the value to the researcher or to the grant writer?
I think researchers are incredibly busy and they have so many commitments. And I think sometimes building these communication plans can seem like just another skill set to develop. And what I would say is for researchers who are, they're running studies which aren't being able to leverage significant resources like some of these large biomedical resources that they have, large teams, is really accept the fact that they should be seeking help and guidance from other organizations. There's many organizations and many people who are skilled in developing sophisticated communication plans. And sophisticated doesn't necessarily mean complex, that they could work with, that they could outsource this. Many institutes have a participant and patient engagement team, and they are there to help. There are many external companies that specialize in accessing key communities in different territories. That's literally their role to do that. There are huge numbers of people on all sorts of sites like Upwork, where you can get access to people who are incredibly good at drafting content that is both interesting and compelling and makes for a great read. And they can also build communication strategies as well. So I think many researchers take on the burden too much onto themselves about how to build purposeful engagement. And what they should really be doing is reaching out very early on and when they're planning a study to find people who can help, because there are lots of people, more so now than ever, who can really help them develop their content and actually make it quite hands-off for them. So all they have to do is periodically contribute ideas and content, and then somebody else generates it and pushes it out to their target, their participant cohort.
In your experience, have you seen that funders themselves are specifically looking for this? Like, where's the driver for this coming from? Is it something that's come down from the funders? Is it something that's coming from the state? Is it something that's coming from patients themselves?
I think all those are true. I think if the funders are, I mean, this is true of the, I think this is true of everywhere. US, UK, Australia, funders are less and less enthusiastic about people recruiting people onto studies and then not having some strategy for engaging and reporting back on outcomes. I don't think they're necessarily mandating sophisticated or purposeful engagement, but they are asking questions about what happened, how are these people going to be engaged in this research, how they're going to be communicated with around this research. I think that, so the funders are putting some emphasis on that. I think many patient advocacy groups, patient charities are thinking more and more and trying to advocate for individuals contributing to research to say that engaging with people, sourcing their expertise, sourcing their time, asking them to do things for you should be a quid pro quo arrangement. There should be benefit to them, and value should be passed back. And I think we can have a longer conversation about what constitutes value, but actually people are interested in not only the research outcomes, but also how they fit into a greater community. So there's an important point there. I think from the researcher perspective, I think more and more people or more researchers are beginning to understand that building a relationship with research participants is how you do great research, really impactful research, because it allows you to not only begin to answer the question that you started with, but it gives you the opportunity through a relationship with participants to actually course correct or go towards what might actually be a more interesting question as you start to understand the data.
So the questions we're asking, we may improve by improving patient participation, better science, I suppose.
Yes.
Okay. And you've touched on there maintaining longitudinal cohorts and building, patient centers that can be tapped into over time. What immediately springs to mind there is the cost and difficulty of doing so. And again, complexity and again, difficulty. And these are questions that researchers are going to be sweating over potentially if asked, how are you going to deploy this over time? How are you going to make sure this set is useful over time? So what are the costs involved in doing that and the lifts involved in doing that? And how can researchers overcome those?
The easiest way to collect data would be arguably a cohort size that would be sufficiently powered to answer your question, and a single time point collection of data. Longitudinal data collection presents a challenge in a number of ways, and in part it's because people have to continue to contribute, and they have to continue to be engaged appropriately, in the sense that they have to, as an individual, be engaged in the study to want to contribute, and to contribute often in different ways as the study progresses. Longitudinal data collection, one of the greatest challenges with that is if you are, say, collecting monthly or every 6 months, and you want to collect over a number of years, is that you inevitably will get cohort attrition. What has become apparent is that cohorts where individuals aren't engaged with a certain cadence, and they aren't in many ways actually asked enough to contribute, so they're not made to, or they're not encouraged to contribute. Often those studies suffer from attrition, which is that the longer it goes, the fewer people are ready to contribute, and the more people, their personal circumstances change, such that they move or they forget about the study, and it actually becomes more and more challenging to collect the scale and quality of longitudinal data that you would hope towards the end of the term of the research. Does that answer your question?
Yeah, that's good. So let's talk about the future. And in your view, what do you see as the exciting developments in this space that are enabling better participant engagement and better study design over the long term?
I think you could break that into probably 2 components. One is that there are better and better examples of great participant engagement and the value that it offers. As a company, we're working with the NIHR bioresource. They are a fantastic example of how a team purposefully engages with their research participants. And that study has been going, or that resource has been going for over 15 years and has 250,000 people part of that. So there are exemplars all around the UK and actually further afield. I think having those exemplars makes it easier to not only understand what good looks like, but also there's an opportunity there for researchers, because those resources are there to support research, not only in terms of having data and materials to share, but you, as a researcher, you can contact them and ask them, how do you approach this? How would you approach this problem? Because those people are, and especially, I mean, for the bioresource, incredibly committed to creating the very best experience for their research participants, and also wanting to help researchers and the biomedical community. So there's exemplars. of great engagement. I think the other point or another component is that there are better and better tools to be able to deliver great participant engagement. And this is just, and I mean this not only from the first thing people jump to is social media. That can be an incredibly good tool. I think it can be a little bit of a double-edged sword. But I feel that there is plenty of expertise available to researchers for running effective campaigns. I think the challenge comes often with social media strategies. It becomes an ad hoc solution. And I think there are far more integrated solutions that can be found. In addition to that, I think there are more and more resources for accessing people on a contractual basis to generate content, to generate engagement strategies, and to be able to monitor their performance. Not only within organizations, so not only within research institutes and universities, but also in platforms that are specifically about accessing people on sort of a consultancy basis to be able to do these types of build these types of communications, content and plans.
Getting into the specific additional features or tools, if you like, beyond the patient management systems and the social media engagement and the multi-channel engagement of patients, there's murmurings of electronic health record integration being potentially a big contributor to this type of research moving forward. What is the place for this in participant engaging research, and where does it become worthwhile for the researchers themselves to build this implementation or to find someone who can do it for them?
I think electronic health record integration can be extremely valuable, obviously, because you'd have clinically validated data. The challenge with electronic health record integration, or the limitation, is that it depends on your target demographic about how much information there is available to you through that integration. And what I mean by this is that if you think pragmatically, if you look at somebody in their 20s, many people in their 20s, not everyone, and it depends on the group that you're engaging with, many people in their 20s don't visit a healthcare practitioner very frequently at all. So if you're relying on electronic health record integration to be a fantastic source of data for a longitudinal study, it's unlikely to offer the richness that you're probably looking for. It would be more relevant as people get into their 40s, 50s, and later decades, because typically people visit have checkups, will get baseline health screening. And so it becomes more relevant at that stage. I think for electronic health record, I think it's a complementary approach to really the strategy of researchers shouldn't shy away from asking research participants for health data and health status and lifestyle data. I think that is incredibly valuable, not only in terms of future-proofing the types of questions they want to ask the data set, but also it can be an important validator of electronic health records. So it's worth complementing electronic health record integration into their study with an active process of surveys, health status and lifestyle surveys to complement that.
For researchers then, where can they go if they have any questions based on our conversation today? If they want to learn more, what's the best way forward?
Because most researchers have to have so many roles and have to have so many roles and commitments to be able to deliver in their role as a researcher. I think often what can happen is that they feel that they have to solve the problem themselves, or they can solve the problem themselves. And while I have no doubt that they could, they shouldn't have to. really they should be speaking to people who are demonstrably skilled in being able to deliver on this type of purposeful engagement. And those can be people, can be Sano. We're always happy to talk to researchers about how they can better engage with either with their existing cohort or one that you want to build. We run our own research studies. We have many of these contain thousands of people, and we've done extension studies where we've taken those people, we've identified a new opportunity to extend the research that we're performing. We've gone through IRB review. We've come out the side and we've reconsented those people onto an extension. We know how to pursue a research question as it changes and as you better understand it. I think researchers shouldn't be afraid to ask for help and guidance. And I think they could start with us, but they can also start in their own research institutes with those specialists who focus on engaging the public, engaging patients, to start to orient themselves on how best to either create, ideally you'd start this process by early in your study design, or sort of retrofit good participant engagement, because maybe you've identified the fact that people are less activatable in your study, so they're less likely to contribute as the study has progressed.
And in your experience then, I'm getting the sense that where academics spend time building these elements themselves versus, have an expert come in and support that process, where do they differ in your view in terms of what their focus is then able to be on and how this affects the development of their research plan? Like what for the ones that have this handled, where do they focus their spare efforts, and how does that affect them versus the comparative?
Yeah, so from a perspective for a researcher, how is their grant writing experience from trying to invent something credible to support in terms of participant engagement, support their study, versus as I advocate, seeking help, seeking guidance, seeking input. I think somebody who's trying to build a program of engagement based on their intuition, maybe even based on a little bit of past experience, I think they might simultaneously underestimate what was required to build a credible and effective program of engagement, and overestimate the required complexity to do it. But Sano, this is literally what we do day to day. And I think for a researcher seeking help, if they came to us, we could just provide content and a strategy and technology that would work out of the box and would just address that part of their grant requirement. They wouldn't have to invent anything new. What we would offer them would demonstrably work. We can show how it would demonstrably work. We can show how, in terms of metrics, how well it performs. So I think if those two hypothetical researchers, one who's decided to reinvent the wheel, the other one who's decided to speak to us, the one who's come to us is going to spend a lot more time focused on their science and a lot less time on trying to create what looks like a credible solution for a funder.
That's interesting then. Do you think that kind of as a downstream consequence of that this technology, in a sense, democratizes a quite complex type of research? So say a more early career researcher, if they went to a funding body with a proposal and they had some technology from us in there that said that it was going to do X, Y, and Z, and there's evidence that it could do that they would be at a more even standing, I suppose, against a seasoned patient engaging conducting that kind of research.
I think that's a very good way to put it. I think researchers using the types of technologies or the technology that we've created, it does essentially democratize great participant engagement. It simplifies it. It allows it. It makes it easier to manage. It makes it easier to review. It allows their researchers to spend more time on research, and it makes it clearer how their engagement is performing. So you could think of it, I'll give you an example. 15 years ago, everybody who wanted to do any sorts of calculations or any sort of high performance computing could only do it at institutes that ran significant hardware. Flash forward 10 years, anyone, anywhere can get access through cloud computing to incredible amounts of storage and compute. That democratized analytics. I think for Sano, I think how the technology that we built to run our own studies and to run other people's studies is exactly that kind of democratizing technology that just a few years ago, the only way that people believed they could create sophisticated campaigns was using ad hoc solutions across email and social media. It would require huge amounts of effort to maintain, and often distracted people away from what they're really there to do, which is the research and answering research questions and developing interesting tools to analyze the data. I think now researchers have the opportunity to buy an off-the-shelf solution with services to support them that would create something that would be equivalent to what a very large-scale research initiative that had dedicated staff for participant engagement. So this I think is going to change how research using participants is done, because research participants are going to be more likely to contribute to the study over time. They're more likely to contribute better data, and they're more likely to continue onto new studies that spur off that first study, because they're having a better experience and they're having better communication, or they're being communicated with more purposefully than they've ever done before.
Let's talk about costs, because it's great to have all these solutions. It's great to be able to buy a competitive solution out of the box, but of course, if it costs you an arm and a leg, it's not going to be that desirable. So for a group that's trying to build this themselves, how would their costs compare to going with an off-the-shelf solution? And I know you're quite in on the hidden costs and aware of the shadow budget, I suppose, that's needed to build these studies. So
Sano has created technology which is incredibly cost effective. And the reason it's cost effective is because it takes away a lot of the effort that in a research group would be a lot of effort around building and maintaining these communication strategies, and then tuning them to meet the needs of their cohort. In doing that, if a research group does that using in-house expertise, using an ad hoc solution, what I think is often not accounted for is that while that postdoc or PhD student or research assistant is administering to that cohort, often using an ad hoc, as I said, ad hoc solution, while they're doing that, they're not doing research. And these problems scale in a very non-linear, or these challenges around engagement scale in a very non-linear way. I had an example of talking to a group where they were doing genetic testing, and they had done a little pilot, and their ambition was to get to, I think it was 10,000 individuals for an oncology study. They did an initial pilot, 100 people for data collection and materials collection. And the postdoc running it had 1,500 emails from those 100 research participants, about data collection, about materials collection, about where they were in the process, when they were going to hear their results. This was a huge amount of time. This is essentially, it became apparent to them that scaling was going to be incredibly challenging unless they managed to rationalize how they communicated with their research participants. It meant that they estimated they had to recruit 2 additional people just to be able to support their scaling, even with optimizing their communications. Really, that is all salary and overhead that is a cost burden on the group. And that runs into tens and tens of thousands of pounds, or whatever currency you're in. This Sano solution can be run effectively by one person, and not even a full-time individual, because the way that you can schedule content, the way that you can preload content, the way that you can monitor the performance of content, and the way that it allows people to contribute into the platform, fundamentally, it just simplifies that entire process, and correspondingly, it would just reduce the cost burden on those groups.
For time as well, I suppose there's a time investment, and there's projections as to how long building study components and engagement components is going to take. What's your view on the difference between a DIY and off the shelf? I mean, it's kind of a loaded question. The off the shelf should work straight away, but practically, what kind of difference does that make to the researchers and to the studies they're allowed to build?
So the benefits of working with an off-the-shelf solution versus an ad hoc solution is that the ad hoc solution has to be like any technology. It has to be built, it has to be tested, and it has to be maintained. And often that is all detracting. That is a salary cost, and often using PhD students and postdocs. And it is a time burden. So it's an opportunity cost to those groups not having that individual spending time doing research rather than running email and social media campaigns in some sort of ad hoc way. From a commercial solution, we've already solved those challenges. We've integrated communications channels. We've integrated ways in which to create content and schedule content in time-efficient ways. And I think we can offer that data sovereignty. We can offer private cloud environments. We offer support. We offer expertise, and we offer business continuity. So when the person who is contributing to that platform and essentially responsible for that platform in the group, when they eventually move on to the next stage of their career, it doesn't really matter, because the next person can come in and pick it up and still consult with us about how best to take that next step forward. An ad hoc solution doesn't offer you that. The person who built it, when they leave, typically in my experience, the group has a problem at that point, because knowledge transfer has to occur for that to continue. Sano does away with that challenge. We are your business continuity. We will continue to support that platform, and we will continue to support the next individual who comes in and who becomes responsible for it.
Thank you, Ross. I think we're pretty much done on time now, but if you could just wrap up with maybe 2 or 3 words that would describe the benefits of your solution, maybe we can finish there.
The way that I would describe our technology is, in one simple sentence, is that it is everything research participant made simple. We simplify that entire process from not only that initial engagement to onboarding and consent, through to ongoing engagement, data collection, through all the way to the end of the life cycle of that research project. We make that entire process simple, straightforward, and knowable. And I think that's really important for researchers to have something that just works. Essentially, our technology just works. And we know this because we run research ourselves.
Thank you very much.